Welcome to the module on spirituality and health. We'll be discussing implications for physical therapist practice. Before we get started with the lecture, here is a devotional thought to help us focus on why whole patient care is so essential. Genesis chapter 2, verse 7 says that the Lord formed man from the dust of the ground and breathed into his nostrils the breath of life. This means that divine influences form the very core of our being, that without God, we cannot fully enjoy life. As physical therapists, we need to be aware and honor the existence of the soul or spirit in connection with the mind and body. Through this module, we will strive to deepen this appreciation. Father, we thank you for the ability to come together in body, mind, and spirit as we learn more about spirituality, health, and your purpose for us as healthcare providers. Please be with us as we review this material and guide us to a deeper understanding of what it means to extend the healing ministry of Christ. Amen. So our objectives this session are to differentiate between spirituality and religion. We will discuss the relationship between spirituality and health using biopsychosocial models, and then we will review methods that can be used to assess spirituality and propose some ways we can integrate spirituality into the PT plan of care. The Oxford Dictionary defines the spirit as the immaterial, intellectual, or moral part of man. What do you think of this definition? In some ways, I would consider the intellectual part of man to be more mind than spirit, although certainly our intellect contributes to a better understanding of God. Spirituality speaks to our innate drive as humans to search for meaning, purpose, and fulfillment in life. During our class session on resilience, and when we watched the movie I'll Push You, we mentioned how having a sense of purpose is very important, especially when somebody experiences a dramatic change in physical ability and their personal roles as a result of illness or disability. Spirituality contributes to our need for hope and the will to live. It allows us courage in the face of fear. In present times, with the COVID-19 pandemic, for many of us, spiritual beliefs have become a great source of comfort. The World Health Organization also says that spirituality is the need for belief and faith in oneself, others, and God. I also want you to think about the World Health Organization definition, and I'm eager to hear about your thoughts. Do you think that spirituality can be explained by the belief and faith in yourself and others, or is a divine force necessary? What about people who are atheists and do not believe at all in the existence of God? Can an atheist be spiritual? As physical therapists, we are called upon to care for people from diverse walks of life. This includes a wide spectrum of religious affiliations and spiritual backgrounds that are often different from our own. It is therefore important for us to be able to make the distinction between formalized institutional religions and spirituality, which is more of an internal personal expression of the sacred. When we discuss measures of assessment, you will see additional differences between religion and spirituality. In many ways, we can assess religion like we would any other demographic variable. We can ask questions like, which religious institution do you belong to? Are you Adventist, Catholic, born-again Christian? How often do you attend religious services? How often do you pray? All of these questions tend to involve well-defined categorical variables. I threw that in for the research fans in the audience. Spirituality can also be measured, but it tends to be a bit more of an abstract construct. We can look at things like someone's spiritual well-being, the sense of comfort that somebody derives from their faith, how spirituality contributes to a sense of wholeness or connectedness, and also how it assists with coping strategies during times of stress and crisis. I think we can all agree that spirituality is a multidimensional concept. As this diagram shows, spirituality involves cognitive, motivational, and affective or emotional components. I'll also be interested to hear how you believe spirituality acts as a personal influence in your own lives, and what is involved when we say that we are taking a holistic view of our patients, including their spirituality. As we've already begun to describe, spirituality influences our perspectives and worldview in a variety of ways. It can provide us with a sense of fairness and justice. It can be used to motivate benevolence or goodness towards others. In fact, I've heard many of you express how your own spirituality motivates you to work hard towards entering a profession like physical therapy, where your lives will be dedicated towards helping other people. Spirituality can also give us a context for a sense of justice. This is something else we've also discussed throughout the term in this class. When we talked about health disparities, we mentioned a sense of duty to ensure that all people are treated with respect as children of God, regardless of their race, ethnicity, or socioeconomic status. This is something that I've seen each of you put into action at the Hope Clinic. You also will put it into action during your international service learning experiences if you haven't done so already. Spirituality and a sense of duty is also something that has motivated me throughout my own professional life and in the delivery of pro bono services. Every single one of us is loved by God. That alone makes us deserving of respect. If you recall, when we discussed differences in intrinsic versus extrinsic motivation, we talked about how religion and spirituality could influence health behaviors, either positively or negatively. When we consider things like the Advent Health System's Creation Life Initiative, or the Adventist Health Study, which traces epidemiological data on how spiritual beliefs contribute to decreased incidence of chronic disease conditions and increased longevity among a population of Adventists in Loma Linda, California, we see evidence of the positive health influences of spirituality. When we look at case studies like the one where the patient with knee osteoarthritis felt that he was embrujado, or suffering under a supernatural curse placed by one of his neighbors, we can see how spirituality can perhaps interfere with the motivation to seek medical attention. I'm going to ask you to watch a film during this module that gives examples of how spirituality and health are closely linked to one another, and how we can work within the confines or within the parameters, rather, of somebody's spiritual beliefs in order to render culturally competent health care. Spirituality can also give us a sense of coherence. It can be the context through which we view our daily lives and try to make things of various things that happen to us. It can give us a sense of stability or confidence in something greater, even when the world at large seems to be in crisis. There have been many times during the past few weeks where I have had to remind myself what God told Joshua in the Old Testament. Be strong and courageous. Do not be afraid or discouraged, for the Lord your God will be with you wherever you go. This has also been my prayer for all of you. The world has suddenly become a different place. You are entering our profession during a time of uncertainty, and I pray that God will sustain all of us, but especially you guys. You are brave, you are strong and courageous, and you are the ones who will navigate our patients through these new storms. It can be challenging to find current high-quality data on spirituality and religion. Many polls and surveys are complicated by sampling error and response bias. Even the Gallup poll, shown on this slide, has issues with the use of telephone respondents and response rates. The data that you see here are almost 4 years old and come from a single sample size of less than 1,500 people, meant to represent the entire population of the United States. However, it does contain some interesting information. In 2016, 89% of Americans surveyed expressed a belief in God or a universal spirit. This reveals a pretty big downward trend when we look at the data from 2006 and even from 50 years ago. So belief in God was pretty steady for a long while and now has dropped almost 10 points in a single decade. What do you think has contributed to this decline? I also found it interesting that 89% of respondents said they believe in God, but only 71% believe in heaven. That saddens me, but of course we don't know how this question was asked. We also don't know how respondents conceptualize heaven. For instance, I certainly do not believe that I will someday find myself sitting on a cloud playing a harp. A cloud would never hold me, and since I have zero musical talent, I will trust Dr. Liphart with providing us with the harp playing. The other surprising thing is that while 71% of people believe in heaven, only 64% believe in hell. To me, that's like saying I believe in light, but I don't believe in darkness. What do you think about this difference? I couldn't locate the statistics from the 2016 poll, but in 2006, 85% of Americans said that religion was important or fairly important to them. This speaks to our need for some type of spiritual assessment so that spirituality can be taken into account during the PT plan of care and interactions with our patients and their families. Also in 2006, 41% of Americans said that they attended church or synagogue at least once a week. I wonder if they asked about other types of religious services, like the mosque. In 2016, 20% of respondents said that they did not belong to a specific group or denomination. This also makes me curious about the way the question was asked. For me, although I am a Christian, the church I attend is non-denominational, so I would probably have a hard time responding to this question. Also, as you know from research class, responses may also depend on the way the categories are defined and listed. This next slide here depicts how spirituality impacts a complete state of health. So when we define wellness, we need to take into account body, mind, and spirit. By influencing our sense of meaning, spirituality can influence our motives and goals, as well as our locus of control and our sense of hope and optimism. In turn, each of these factors can influence proximal pathways to health, such as our health behaviors, our stress levels, our coping strategies, and treatment adherence. On this slide, I've included some examples of excerpts from some religious traditions that illustrate connections between spirituality and health. For example, there's a verse in the Quran that says, and if any of you speak Arabic, please excuse my translation, it says that when I am ill, it is God or Allah who cures me. Proverbs 3 verses 7 and 8 tell us that a peaceful heart leads to a healthy body. Another example from the Old Testament can be found in Isaiah chapter 58 verse 11, which says that the Lord keeps us healthy. The Torah book of knowledge says that maintaining a healthy and sound body is among the ways of God. And Buddhist teachings also say that it's our duty to maintain good health because good health helps keep us able to attain further wisdom. Since spirituality and health can affect motivation, we need to consider how that sense of meaning can influence certain health outcomes. Among our older adults, a sense of meaning and purpose can serve as motivation to maintain physical and mental health. My Nana lived to be almost 101, and I know that a great part of her motivation was her devotion to her family and taking care of all of us. She truly felt as though taking care of us was part of God's purpose for her life. For adolescents, a sense of meaning and purpose has been shown to be protective against suicide. From a practical standpoint, belonging to a religious congregation can enhance social support. Although we often think about this in terms of the benefits of receiving support, providing support for others is also beneficial. I know that I would not have been able to get through my PhD program without the support of the older adults in my church community back in West Virginia. Their prayers and things like study care packages got me through some very rough times. I was happy to give back to them in ways that included company on doctor's visits, answering medical questions, and providing home PT for people who were uninsured or underinsured. So we need to consider that this, in fact, is a reciprocal pathway. The research on this slide is also a lot older than I would prefer, so it's not from the last 10 years. But it does speak to the need for further studies in the area of spirituality and health. I've included this information because I think it's very important for us to recognize how many of our patients want their providers to consider their spiritual outlook when providing care, and how few physicians actually do this. What do you think some of the barriers might be towards providing spiritually competent care? When we're treating patients, we also need to elicit information and consider how the patient's spiritual beliefs affect their relationships with us. Many patients believe that God is working through us. I remember one of my patients saying that she could feel God through my hands. She said this while I was working on her cervical spine, and when she said it, I was actually silently praying for her and for me. She was in a lot of pain that day, and I felt very limited in what I could do to help. So I was asking God for guidance and healing. Of course, I'm sure you are surprised to hear that when the patient said that, she made me cry. Or it made me cry, rather. And Shika, I know you're with me here, right? Just like any other individualized aspect of care, spirituality needs to be integrated into our tailored physical therapy goals and interventions, even if that intervention simply means collaboration with pastoral care, the chaplain, or another member of the interprofessional team who might be able to work with us and our patients to ensure a holistic perspective. There are several overlapping features between spirituality and other aspects of culture. For example, in many African American communities, spirituality is a very dominant domain. Recognizing this can allow us to create important community-level interventions that can help mitigate certain health disparities. When working in public health, I was part of an initiative to reduce hypertension among African Americans. An educational program was created and delivered in collaboration with AME churches. These programs were led by pastors and church elders with consultation from the healthcare providers like myself, and they were very well attended by members of the congregation. This slide shows a flyer from another similar initiative that resulted from collaboration between the United Methodist Church in Buffalo, New York, and the University of Buffalo, as well as other members of the Western New York Health Coalition. I think that these types of partnerships can be very beneficial for physical therapists, especially as we expand our focus into community health and wellness. Religious sponsorship of health programs can increase access and create resources in underserved areas. Here you see an example of a program in Missouri that involved mammography screening. The mobile mammography unit visited a local Baptist church so that people who would otherwise have difficulty getting to a fixed location could take advantage of these services. Other examples include food banks and homeless health clinics like the one at St. Francis of Assisi in New York City. St. Francis was able to combine health outreach with their soup kitchen and food pantry to serve the large homeless population in Midtown Manhattan. We also need to consider how our own spiritual and religious beliefs influence our views on patient care. Some research shows that more health professionals self-identify as agnostic or atheist in comparison with the general public in our patient base. What factors do you think might help explain this difference? Also, I want you to think about how the lack of religious or spiritual beliefs may influence a healthcare provider's perspectives on patient care. Is it possible that someone with religious spiritual beliefs might have a hard time adapting to patient diversity? What if the provider is very religious, but the patient is an atheist? All of us have to be cognizant of ways that spirituality can influence health. Due to its influence on our sense of meaning and purpose, spiritual beliefs can provide a framework for understanding illness or disability. It also influences patients' healthcare decisions, something we may need to respect, even when the patient's beliefs interfere with what we would consider the best possible care. Can you think of some possible examples of this? Spirituality can also provide a sense of community for both patients and practitioners. I know that I feel closer to all of you when we pray together before a class, or when I pray with my colleagues and patients in clinic, and when patients request prayer. We definitely need to remain open to consider the possibility that the effects of spirituality can be both positive and negative. In some cases, religion and spirituality can be a source of distress, especially when the person or the provider starts to interpret illness, injury, or disability as some kind of supernatural punishment. We touched on this a little bit already, but let's talk about some of the ways spiritual beliefs could influence patient education and adherence. Could our religious beliefs contribute to an external locus of control where everything is left in God's hands, abdicating any sense of personal responsibility? Or could it be used to augment an internal locus of control, where we feel as though we have already done everything in our power, and belief in God's ability and His ability to heal will bring us an additional source of comfort? As you will see in the film that I have asked you to watch, spirituality can also influence the use of alternative or adjunctive interventions. When we convey a sense of respect for our patient's spiritual beliefs, this can cultivate a level of trust and openness that enables the patient to discuss the use of these alternative treatments with us. Many times, it's extremely important for us to know that these alternative beliefs exist and that the alternative treatments are happening so that we can work within this context when delivering care. As I mentioned briefly, there may be a dark side to spirituality and health. What if the person's religious beliefs become a motive for medical neglect? Faith healing alone without medical care can have very serious consequences. And then there are examples of conflicts between religious beliefs and recommended medical interventions. Respect for the patient's spiritual perspectives can sometimes assist us in being able to negotiate a compromise or finding other viable alternatives. I think I've already shared this story, but when I was working in acute care as a wound care specialist, we had a patient who was Muslim and adamantly against the use of pork products due to his religious beliefs. He required treatment with a skin substitute because he had an extensive non-healing wound that was so large that it would need to close a little bit before we could do a skin graft, because there wasn't the possibility of taking a graft so large from any donor site on the patient's body. The attending surgeon insisted that he wanted to use a porcine skin replacement product. Porcine means pork-based, because that's the way he always did things. And the physician openly expressed that he thought that the patient's religious views were ridiculous. I had a different perspective. I don't hold a belief myself against the use of pork products, but I thought that the surgeon was being ridiculous, because there are indeed several different alternatives to porcine skin substitutes, including things like cadaveric skin grafts, as well as bovine and ovine-based products, that's beef and sheep, and acellular dermal components. Thankfully, the chief of medicine and the patient advocate got involved, and an acceptable resolution was reached with the patient and his family so that he could receive culturally competent care and avoid the use of pork products. Sometimes you will hear people criticize religion as creating negative consequences and conflicts such as genocide, honor killings, and female genital mutilation. Stereotypes, bias, and religious persecution are other factors that could possibly have a negative effect on health. Next, we're going to talk about the different ways that spirituality may manifest as coping styles. Some people see themselves as operating totally independent of God. This would be considered a self-directed coping style. Completely opposite, people with a deferring style may take a totally passive role, waiting for God to resolve the situation. Collaborative coping styles involve seeing oneself as acting in concert with God, relying on God while also exercising your own abilities to address the situation at hand. The surrendering coping style may occur when people feel as though they've exhausted all their own resources. Make no mistake that the surrendering coping style is not simply giving up. It's a conscious decision made to rely on God. Some sources suggest that a belief in a just and benevolent God in times of crisis may actually be more beneficial than a belief in fate, even if the outcome is the same. This is something I saw when working with patients in hospice. For terminal patients, religious beliefs and spirituality seem to be a greater source of comfort than for those who do not profess any type of belief in the divine. We need to consider how these different types of coping styles may influence healthcare. A collaborative style could provide a sense of greater empowerment for the patient, as long as it doesn't diminish our sense of personal responsibility. A deferring style may not necessarily be a bad thing, especially when adapting to an uncontrollable, extreme situation such as the death of a loved one. It is important for us to recognize that sometimes a deferring or collaborative coping style can reduce the likelihood of patients discussing their health outcomes, or rather their health concerns, with the provider, especially if the patient thinks that we won't receive or respect their spiritual beliefs. So the fear of judgment has a very powerful influence on the ability and willingness of our patients to discuss these types of issues with us. As a coping mechanism, spirituality can inspire feelings of hope, gratitude, and optimism. Some strategies for engaging these benefits include journaling. Spiritual coping may also enhance a sense of self-esteem and self-efficacy, and it could be associated with lower levels of anxiety and psychological stress that accompany illness and injury. Here's an example of a verse that can assist with psychological coping in times of stress. Philippians chapter 4, verses 6 through 7. Do not be anxious about anything, but in every situation, by prayer and petition, present our requests to God. And the peace of God, which transcends all understanding, will guard your hearts and minds. Specific to PT practice, we may be privileged to have our patients share more information with us about their spiritual beliefs as a benefit of the level of trust and rapport that develops over time, because we have longer visits with our patients, and we also have repeated interactions over the episode of care. This is in contrast with other types of health professionals who may only see the patient for short, sporadic visits, where there is less time and less ability to focus on interpersonal connectedness. Even the Joint Commission recognizes the need to integrate spirituality and health. According to Joint Commission guidelines, spirituality must be assessed for all patients that are admitted to hospitals, nursing homes, or home care. There are some specific requirements regarding which type of information we obtain from the patient, but there aren't any specific guidelines regarding which member of the interprofessional team should perform the assessment or how the assessment should occur. Sometimes the requirement can be fulfilled simply by asking demographic questions about religious information and affiliations. In particular, in home care, if you're the physical therapist who opens the case, or you're the only healthcare practitioner who is seeing the patient for services, you may actually be the one that performs the assessment. As mentioned previously, religious beliefs can influence personal health behaviors. Some religious groups stress the importance of self-care due to body sanctification. Self-care can also be seen as a religious duty and may influence beliefs about certain behaviors such as dietary guidelines, alcohol use, tobacco use, and other types of substance use. There is also research showing the health benefits of certain religious practices such as meditation and prayer, both of which have been shown to reduce physiological stress response. As previously mentioned, in teens, religiosity is associated with a lower risk of suicide. Religious affiliation in teenagers is also associated with lower rates of other health risk behaviors, such as substance use and sexual promiscuity. Research also shows that trust in a higher power and other aspects of spirituality may enhance positive attitudes and the interpretation of illness in people who are living with chronic pain. It can also help in coping with long-term disability and providing a new sense of meaning in people with permanent or progressive physical impairments, such as traumatic brain injury, spinal cord injury, and CVAs. As I mentioned before, there is definitely a need for further research in the areas of spirituality and health. Potential research questions might include things like the association between spirituality and chronic disease incidence, as we see with the Adventist Health Study. The Adventist Health Study followed a cohort of Seventh-day Adventists living in California, as I mentioned before, and it tracks things like rates of cardiovascular disease, hypertension, and premature mortality. And what they found was that on average, people living in that Adventist community, tend to see about 6 to 8 years longer life, and they have substantially lower rates of diseases like stroke, diabetes, and heart attacks. And so a lot of that can be traced back to certain health behaviors like dietary guidelines, the fact that a lot of people who are Adventists are vegetarian. There is a decreased use of tobacco, caffeine, and other types of substances, etc. If you get a chance to look at the public health research that has come out of the Adventist Health Study, I would strongly recommend it. Also, we can do research that explores the basis of the relationships between spirituality and health, besides just health behaviors. And we can plan and assess the effectiveness of spiritually based healthcare interventions, such as the Creation Life Initiative that we see here at Advent Health. What types of other research questions and topics do you think that we should consider? I'd be interested to hear your ideas, especially as they relate to PT. Research on spirituality and healthcare face many different challenges. There's a clear need for longitudinal designs that help us elucidate the cause and effect relationships. You'll generally see more cross-sectional studies on topics involving spirituality and health than longitudinal studies. And we know from cross-sectional studies that we gain information on associations, and people may try to imply cause and effect, but without the longitudinal time component, we really can't do that with any type of reliability. Also, the body of literature would benefit from more diverse samples to help tease out spiritual influences from different denominational associations. Mixed methods research is also beneficial to allow a mix between quantitative and qualitative data, and also to enable us to consider multiple factors that influence concepts of spirituality and health. Bias is obviously another important consideration, along with the need and willingness to consider both the positive and negative influences of spirituality. From a physiological perspective, there may be some measurable physical effects of certain spiritual practices. Let's consider a few of these. Prayer and meditation have been shown to influence the sympathetic nervous system response. The effects of prayer and meditation may include things like slowing heart rate, reducing respiratory rate, lowering blood pressure, and reducing anxiety. Central nervous system effects of prayer and meditation also include increased blood flow to certain regions, such as the frontal cortex, cingulate gyrus, and the thalamus. Prayer and meditation have also been shown to enhance immune response. One of the challenges in research involving spirituality and health has to do with research methodology and design. In science, we tend to favor randomized controlled trials, but in studies involving prayer and meditation, what is the basis for comparison? Can we create a true placebo to prayer? Again, in this slide, I apologize because the research cited is 15 years old. And honestly, the study that is cited has problems with methodology, just like the Gallup poll, but at least this shows the potential for prayer to decrease pain intensity. Apparently, the type of prayer also matters. Conversational and meditational approaches to prayer were shown to be more strongly associated with well-being than ritualistic prayer. Collectively, the physiological responses to meditation and prayer may be referred to as the relaxation response. As we said before, it helps to calm the sympathetic nervous system, and it decreases cardiopulmonary activation as well as muscle tension. Studies have shown that this relaxation response can be elicited by certain types of practices, such as repeating a word, sound, phrase, or prayer that holds some type of personal meaning. I received my own meditation training through the Chopra Center. Dr. Chopra's staff uses an approach called primordial sound meditation. Oh my goodness, I can't even say it. The concept of primordial sound meditation involves charting the time and date of your birth, or the point where your soul came into existence, according to the Chopra Center. Based on this chart, primordial meditation contends that you can go back in time to the sacred sound that was being generated by the universe when your life first began. According to this belief, these sounds go through a fixed cycle. Based on the chart and the sound the universe was making when your life first began, you are given a specific Sanskrit mantra. I can't tell you my mantra because it's supposed to be top secret. In fact, they don't even write it down. They whisper it into your ear. While I love the idea of meditating with a mantra, and I have been using this technique since 2005, I quickly changed from the Sanskrit mantra to something a little bit more familiar and less top secret. This mantra I can definitely tell you. It's Psalm 46, verse 10. Be still and know that I am God. This mantra reminds me to relax and let God be God. Have you heard the song by Natalie Grant called King of the World? I'm going to post a link for you. It talks about letting God be God. Sometimes I also use Philippians chapter 4, verse 13 as a mantra. That tells us that we can do all things through God who strengthens us. Or Romans 8:28, that reminds us that all things work together for the good of those who love the Lord. Please let me know what phrases, words, or verses are meaningful to you and could potentially be used for meditation or prayer. We're going to switch gears a little bit now and talk about different approaches to spiritual assessment. In some ways, our conversations and interactions with our patients can serve as an avenue for informal spiritual assessment. Sometimes patients will share spiritual aspects when they're discussing their history with us or telling us their reasons for seeking PT or other types of things that help motivate them. We may infer certain beliefs or values based on our conversations and the patient's choice of language. These inferences can be confirmed through reflective listening so that we can avoid acting on assumptions alone. In terms of formal assessment, we should consider what the Joint Commission minimal requirements are, and this includes data collection on patients' denomination or faith tradition, as well as their significant spiritual beliefs and important spiritual practices. As with other aspects of patient care, we can take a spiritual history that encompasses patients' spiritual beliefs and practices, the religious traditions of their families, and the patient's role within his or her religious community. There are also some standardized tools that can be considered. This slide has an example of some of the spiritual assessment questions that are posed by Joint Commission. Who or what provides the patient with a sense of strength and hope? How does the patient use prayer in their life? How does the patient express their spirituality? How would the person describe their philosophy of life? What type of spiritual or religious support does the patient desire throughout the course of their care? What is the name of the patient's clergy, minister, chaplain, pastor, or rabbi? What does suffering mean to the patient? What are the patient's spiritual goals? And is there a role for church or synagogue in the patient's life? And of course, as I said before, we should try to be a little bit more inclusive and ask about other religious institutions and affiliations as well. The method of assessment that I tend to favor when I am taking a spiritual history is the HOPE tool. It's quick and it's relatively easy to remember. It helps us keep in mind important aspects of spiritual assessment. Learning more about the patient's sources of hope, strength, comfort, and meaning. O stands for obtaining information about the patient's organized religion, if there is one. Asking about personal spirituality and practices, and considering what effects these factors will have on the patient's medical care. There are definitely some ethical considerations that we should be aware of when we are attempting to integrate spirituality and health. These include a strong need for a collaborative approach. Respectful dialogue with our patients and their loved ones allows us to identify needs and an expression of beliefs that may be different from our own. It also allows us to respect the patient's autonomy and avoid providing unwanted religious or spiritual influence and advice. While it may be acceptable to pray with our patients, we need to be careful not to make promises or guarantees about health outcomes, whether these promises are explicit or implied. And as with other aspects of cultural competence, We also need to be aware of our own spiritual beliefs and their potential influences on our interactions with our patients. Scope of practice for physical therapists is another important area of potential concern. General spiritual care can be rendered by all members of the interprofessional patient-centered care team. However, specific religious needs should probably involve someone within the same faith community as the patient, such as the chaplain, priest, or imam. We also need to be attentive to the timing of spiritual discussions. While some initial information can be gained from the patient's history, it may take time for us to develop patient rapport throughout the episode of care that would be conducive to discussions of deeper matters of faith and spirituality. We also need to keep in mind that we are having encounters with patients who come to us at very vulnerable periods in their life. Our patients are dependent on us for material assistance and can sometimes feel indebted to us in ways that make them feel as though they cannot openly refuse to discuss certain matters, especially things like spirituality, if they think that this could be in conflict with their own beliefs and practices. So if they're anticipating a difference between their beliefs and our beliefs, it could shut down open dialogue. That fear of judgment can really interfere with communication. On the other hand, we have to be careful that our beliefs are not so outspoken that it causes patients to silently acquiesce and seemingly accept spiritual practices that are offered to them by healthcare practitioners because they are hesitant to refuse and potentially anger us or distance us, which would then affect their quality of care. We also have to be respectful of our own beliefs, and if they're different from our patients, or if you are somebody who is agnostic. Even people who are religious may feel uncomfortable or unprepared to integrate spirituality within PT practice. Certainly, it takes opportunity and experience for us to become more comfortable discussing personal issues with our patients, like spirituality. Lack of training, fear of negative response, and lack of peer or administrative support can form additional barriers towards spiritual care. And finally, as with all aspects of physical therapist care, time constraints can interfere with the ability to render spiritually informed treatment. We might be hesitant to engage in conversations about deeper matters when there are already so many other things that need to be accomplished within a short period of the patient's visit with us. So, we covered a lot of ground today, and I'm eager to hear your questions and thoughts about these topics. I'm going to post a discussion board so that we have some space to talk with one another about some of the issues that were raised today. I'm also going to post a link to a film that I'd like you to watch and an article that you should review. Since it's challenging for us to meet in the Canvas conferencing, and Center for Educational Technology has asked us to preserve live discussions for when they're absolutely necessary, I'm going to post an assignment with some questions. Your assignment, please be brief. You can make bullet points if you want. I'm not taking any types of points off for grammar or punctuation or anything like that. There's 4 questions, and it will be due next Tuesday, March 31st. Also, make sure you use the discussion board. You know how to reach me either by email or by phone. You are welcome to text me if you want. You have my telephone number, but just in case, it's 631-827-3008. So I look forward to hearing from you, and thanks so much for your time and attention. All right? Be safe and be well.